Well, here's part 2, what nobody asked for, but we're going to get anyway, because some people like to talk about shit that they don't understand. Roll the tape.
The video about Dylan did spark a lot of hatred at me because I'm being labeled as transphobic.
I mean, if the shoe fits.
I do have a problem with pediatricians giving children, adolescents, a drug that is a chemical castration drug. I'm sorry, I don't agree with that.
Okay, let's talk about this chemical castration drug that you're talking about, Lupron. Also known as Lupron Depot, Eligard, Depot PED, Fenzilvi, several different category of drugs. It's not just a chemical castration drug, and it's not permanent. These drugs are actually used to treat prostate cancer and other kinds of cancer, as well as to treat precocious puberty in little kids. Amazingly, this drug works fantastic for people who have endometriosis. All this drug does is decrease the amount of hormones that are in your body. It's not a permanent thing, it's temporary. When people stop taking this drug, their hormones start to increase again and they go back to normal. That's it. That's all this drug does.
Maybe therapy, counseling, things of those natures should be done.
It's really evident to me and other people who are transgender or transgender adjacent that you don't understand the process of how to get on hormone replacement therapy or any of these kind of drugs. And it's actually very involved, especially with children. It requires a team of doctors that includes a social worker and a therapist. Before these drugs can even be prescribed, your child has to go through therapy and talk with a social worker about their dysphoria and anything else that might help them with their transition. Being able to be treated with hormone replacement therapy and puberty blockers is huge in taking care of transgender youth and preventing suicide. Because transgender youth are the most at-risk demographic for suicide for teenagers. When we say protect trans kids, this is what we're talking about. So for future reference, maybe you shouldn't be talking about things that you don't understand. Do better.